And we're back with Dr. John Kressel of Phoenix CyberKnife, and we learned a lot about the options at CyberKnife earlier, but also Dr. Kressel brought along with him Harold Anderson, who is a patient with CyberKnife. Welcome, Harold. Thank you for being here. Dr. Kressel, first of all, tell us what brought Harold to you to begin with?
Well, Harold showed up with a diagnosis of prostate cancer after being evaluated by his family physician and his urologist for a rising PSA, which many times can signal the beginning of prostate cancer.
Mm-hmm. And you had mentioned in the last segment, you were explaining how there are options at CyberKnife. We often talk about the shorter treatment plans that are also good options, but Harold wasn't a good candidate for that. Why?
Yeah, a couple of reasons. A little bit more advanced, a little bit more risk involved with his disease.
Okay.
And the best option for him was a combination of a little bit of androgen deprivation or testosterone blockade, along with the full course of radiation therapy to treat not only the prostate, but also some of the tissues surrounding it because of that little bit increase in risk.
Right, right. Now, Harold, let's talk about when you first learned of your prostate cancer. What was the first thing, if you recall, that ran through your mind?
As I recall it, there's a feeling of numbness. It's like, this can't happen. I can't have this kind of thing. And then after discussing it with my urologist, Dr. Kaplan, it became a little bit more soothing, but still there's that trepidation that you're going into something that you don't know anything about.
Absolutely.
And but the first sign that things were going to go well was when he tapped my knee and says, "Don't worry, you're not going to die."
That's reassuring.
That was gratifying.
Absolutely, absolutely. So you've been through how many treatments just recently?
45.
45 radiation treatments. Did you have any side effects from those?
Very little, very little.
And is that normal, Dr. Kressel?
In the majority of patients, yes. Done properly, and confining the radiation to the areas that you want the dose to go to, and protecting or excluding the normal tissues from radiation can minimize the side effects greatly.
So walking in for the first time, Harold, and not knowing really what to expect, what was the first thing that they asked you when they brought you into this great big room that can be a little scary and intimidating?
Well, you walk into this sterile environment, and they introduce themselves, and then the first question they asked was, "What kind of music do you like?" And I said, "Well, there's a funny thing here, but..." It's a minor thing, but it's so relatively important because it's better than laying on that table and having the machine wave back and forth across you. And looking at a stark ceiling, you've got the calmness of the music.
How long were your treatments?
45 days.
45
5
days.
days a week for 9 weeks.
How long was each
The
treatment?
treatment itself ran around 10 minutes, like
That's
10
it?
to 12 minutes, yeah.
Your wife said she didn't even have time to bring a book anymore.
No, she was really disappointed. She had
Oh, I'm sorry. But how are you feeling today?
I'm feeling great today.
Great.
Yeah.
Great.
The only thing I feel now is the anxiety of waiting to find out the result, which you can't tell for 2 or 3 months.
All right. Well, we will be waiting with bated breath on that. And all right, Harold. Dr. Kressel, thank you very much. Sure. Good information. I want to give you some information. If you have any questions for Phoenix CyberKnife and Radiation Oncology Center, you can email them directly at info@pcroc.com, and they will answer your questions for you. And here's where they're located, at 4611 East Shea Boulevard in Phoenix. And you can also call them at 602-441-3845. Learn more at phoenixcyberknifecenter.com.